Good morning, everyone. Uh, I'm Sam. I'm with Aster Marketing, JP Nagar unit. It takes me immense pleasure to welcome you all on this Golden Hour session. Basically, we started this online program to create awareness on heart attacks, MI on stroke, which you all know that's a leading concern and one of the major spotlight on the death starting now. And this session would give you insight how to go about this. And yes, this online has got a huge, tremendous response from a lot of doctors, and the program is running smoothly. And we thought we can definitely get your media people also involved in this. And the agenda is going like this. I would like to welcome Dr. Venkatesh, our lead consultant, cardiology department and interventional cardiology, and he is there with us from the day of inception, and one of the senior consultants with us. And followed by that, we'll have a basic life support session by Dr. Harish, and we'll have Dr. Shrikanta Swami, our lead consultant cardiology, taking care of this program. So without taking much of your time, I would request Dr. Venkatesh, our lead consultant, to brief us on the session.
Morning, everyone. I hope I'm audible clearly. What I would like to do is that I have a very short 3 or 4 slides to show, because whenever it comes to lectures, we doctors tend to go overboard and keep talking. The questions which are there from the audience, especially people such as yourselves, you will have a lot of questions beyond what lay people ask, because you have also read about it a lot, you have reported about these a lot. So therefore, questions remain unanswered if there is a one-way communication. So what I suggest is that I'll just take about 15 minutes or so. And after that, once I finish, we'll open this session for all questions pertaining to the heart, hypertension, etc. My other senior colleague, Dr. Shrikanta Swami, will be talking about heart strokes. So other than that, about heart and hypertension, we can have any questions from the audience. You could unmute yourself and ask questions. So as long as we have some kind of a series sequence in which we ask and don't overlap questions, I think we'll all get. I'll be able to answer most of the questions. I think. So if you are okay, then we will start off. I'll share my screen so that the presentation comes on. I will tell you a few stories. Basically, what I'm going to do is just tell 2 or 3 incidents that we have witnessed, and based on that, the question answers can be seen. Now, the first story is. This is about Dr. Jeremy Morris. Jeremy Morris was a British physician in the Indian Army during the time of World War II. He worked in the eastern part of India and helped the British Army, which is essentially Indian Army. And once the World War finished, he went back to London. When he went back to London, he had seen too much of blood and gore in the war, and he decided that I'm not going to take care of patients anymore because I've had enough of patient treatment. So he decided to go into a field then just beginning called as public health. He said, let me look at how to improve public health. What he did first was he started working in the London Transport Department. And he went and looked at the health of the workers there, and he found something very peculiar. We all know that the London Transport Department has double-decker buses, and he found something very strange, that the conductors and drivers had different health problems when it comes to the heart. He found that the drivers of these double-decker buses had almost twice the number of heart attacks compared to the conductors. So he is, kind of intrigued because he found that they come from this similar socioeconomic background, their dietary habits are similar, their activity other than the work pattern is similar. They have similar habits like smoking and alcohol and all that. their food habits were similar. So why would the drivers have more heart attacks than conductors? So when he went into this detail, he realized one thing, that on an average, a conductor in a double-decker bus climbs 800 steps in a day, on an average working day. And the drivers obviously are sedentary. So he came with this hypothesis that maybe this climbing up and down is protecting the conductors. Remember, in the 50s, we didn't think very highly of exercise. In fact, the theory that exercise protects against heart attacks were not very rampant at that time. So to test this hypothesis, he went to another department in London. He went to the postal department, and he saw that there were two different kinds of workers. Some of them, on the screen, you can see that people who sit on these sorting desks and sort the letters, they are sedentary. Compared to that, he found that the people who actually deliver the letters on cycle or on foot, they had far lesser heart attacks than the people who sort. So he came up with this hypothesis, and that time he studied this. And in fact, this is among the first publications which said that heart disease has a relationship with physical activity. And this paper in 1958 is one of path-breaking papers about how exercise protects against heart attacks. And later on, in fact, Jeremy Morris went on to become a regular walker, and I think he died in 2007. Until then, at an age of 98, 99, he died. Until then, he was a regular daily walker. So this is about physical activity. And I will move on. I'm not going to give you the theories behind that because the question should come. I will move on to the next story. Now, this is a story which is a little heartbreaking, I must say. I was in another hospital before, and that's where I saw a few years ago, 3 or 4 years ago, this patient. 36-year-old bank executive, smoker, obese, typical bank executive, was sitting in the office all the time. He used to complain of burning in the chest for 2 weeks. Every day he used to say that, okay, I had Chinese food today, that's why I'm having burning. Or he would say that we went out today and had a beer, and that's why I'm having burning in the chest. So this he kept on complaining to his wife, who finally got fed up and said, if you have this much of symptoms, why don't you go and show to a gastroenterologist? Get your stomach fixed. So this man went to his office next day, the bank, which was near the hospital where I worked earlier. And there he went to his boss to take permission, go to the hospital and come back. While talking to his boss, he fell down there. He became unconscious. And within few seconds, he woke up. And people obviously realized there's something wrong with this man. Then they took him, put him in a car, and they drove towards the hospital, and which is a very short distance, about maybe 200 meters. As the car entered the hospital gate, he became unconscious once again. He was rushed into the emergency, and the emergency doctors realized that he is having a cardiac arrest. And cardiopulmonary resuscitation was initiated. Dr. Harish will be demonstrating how to do that, but then our emergency team started doing that. I was operating upstairs. I was called down. We took this patient into the cardiac cath lab with an intention of doing an emergency procedure. We tried doing that with all the struggle of about 3.5 hours. Unfortunately, we couldn't save him. When I finished this whole, resuscitatory procedure and failed, came out to, inform whoever brought the patient to the hospital, I saw a young lady, maybe around 32, 33 years old. And I also saw a little girl, maybe around 6 or 7 years. And I believe I heard, I had not known this family before. There was another child who was less than a year, who was left with a neighbor to take care. Oh, this kind of disturbs us, that young lives being lost. But then one ponders about certain questions. What is the impact of this kind of an event? We all know that the patient is no more, could have had a great life, is not having that. So that, I think, personally is an impact for any one of us who suffer with health consequences. For the family, obviously, I do not know whether the family has the wherewithal to, take care of itself, even if there was enough money kept, children being brought up by a single parent, we all know how difficult it is in this big bad world. And for the society, of course, it's a great loss. This young man could have contributed so much, educationally, culturally, economically. It's a productive individual, and this kind of loss of life impacts society in the long run. So it's an all-round loss for everybody, and of course, it's a great tragedy. One saddens, one is saddened with this. So what happened here? What went wrong is something which we should look at. I think the warning signs were ignored. This man had been having chest burning for about 2 weeks, but didn't think that it could be a cardiac issue. Had he gone, I'm not sure whether we doctors or hospitals can change fates. I don't know whether something like fate exists. But then one always thinks 2 weeks the man had been having chest discomfort. If he had gone at least to a physician or a gastroenterologist, they would have said, no, this is not looking like a gastric problem. Why don't you get your heart checked? Maybe there might have been a diagnosis, there might have been some medication, maybe this life might have been saved. The person didn't think, in spite of the fact that the smoker, obese, and not very fit, he thought that it can't be a heart disease, maybe. I mean, that was probably an error here, because sometimes that error here, because that we can be afflicted by a disease as severe as a heart disease, because heart attacks happen in older people is what we. So I think to know or to realize that no one probably is immune except very small kids. I think we have heard of 20-year-olds, 30-year-olds, 40-year-olds coming down with heart disease. So once we know that this can affect us, I think it's important for us to, get ourselves evaluated. Right. So this is a, older gentleman, maybe 65, 70-year-old gentleman, who developed chest pain in the middle of the night. There's an apartment complex. They lived on the 8th or 9th floor of the apartment complex. When he complained of that, his daughter was there, a middle-aged lady who was there in the house. And this the person told that, look, I'm having chest pain. It looks like I'm having a heart attack. So this his daughter didn't know what to do. So she went across the corridor, the opposite flat, and the younger man. She knocked the door, and he came out, and she told, looks like my father is having some heart disease, heart problem. Can you come and help us? So this man went across to their house, saw and heard what happened, how there was chest pains and sweating. And he told, uncle, it looks like you are having a heart attack. So what is to be done? He said, there is a doctor in the next block. So this man goes down 8 or 9 floors in the lift, walks across to the other block, goes up maybe 8 or 10 floors in another lift, rings the bell, middle of the night. The doctor is sleeping. He rings the bell. The doctor comes out in his pajamas. He says that my neighbor seems to be having a heart problem. Can you come and check him? Nearby hospital, nearby nursing home kind of a thing. The stretcher is brought out. He's made to lie down on the stretcher, and he's taken inside. And there a duty doctor examines him, checks the blood pressure, pulse, the usual things. Then an ECG is performed, and looking at the ECG, the duty doctor says, this is a heart attack. Can you treat this? Sorry, we are a pediatric nursing home. We don't have a physician, we don't have an ICU, and we don't have the facility to deal with the heart attack. Now, from the beginning, when the patient complained of chest pain till now, nearly an hour has elapsed. We know that time can be very crucial in a heart attack. We know from our beloved Puneet Rajkumar that he was in a gym, he developed symptoms, but by the time he reached the hospital where treatment would have been given, we lost him. So sometimes heart attacks don't give us that kind of luxury of time. And whenever a heart attack is diagnosed, we must immediately act upon it. So That's why there is an adage called time is muscle, and that's why this whole concept of golden hour is there. So typically, this is the story. Then, of course, this daughter realized that we are wasting time, and she brought him to our hospital. And the cardiac team was called in. I came in 20 minutes. We took us to take him into the cath lab and do an angiogram, find out that there is a block, and we cleared that block, and he became all right, and he's doing fine. So the thing is that this is the common story. Somebody complains of a chest pain. We don't know what to do. We call up a friend who's generally either we are the smart guy in the group or there is a smart person in our group. We call up and say, Guru, I have a problem. My mother is having chest pain. What should I do? He will say, oh, no, I know Dr. Venkatesh very well. He's a great cardiologist. He will take care of your mother. Let me call him. And these people are in Nagar, and they call me and say that we want to bring this person all the way across in the middle of the night for treatment with you because we trust you. Now, this kind of doesn't work very well because we don't know what to do. In your workplace, in our hospitals, in the malls, in cinema halls, the fire escape plan is there. In the airplane you sit, the first thing they'll tell you is there is a fire hazard. This is the road you have to follow. These are the doors you have to escape from, and you have to, kind of assemble at a place. This is there. The drill in case of a fire is already there for all of the other conditions. Whereas for a heart attack, we have no plan. So I think the first aid starts here. We should all know if in the house or in the workplace somebody gets a chest pain and we suspect it's a heart attack, what is to be done? The first thing that is to be done is give a tablet called as aspirin, 350 milligrams of soluble aspirin or dispersible aspirin, but dispirin or aspizole is available. We put that in the mouth of the patient, ask them to chew, swallow, or put it in a glass of water, dissolve it and drink it up. So that's one first aid. The second thing is we should already know which is the nearest hospital which has the facility to diagnose and treat a heart attack. These are tertiary care hospitals in general. Smaller hospitals don't have all the facilities. But depending on the vicinity of where we are, whether we are in a big city, whether we are in a smaller town or in a village, whatever is the place which can treat us, we should reach that place fast. How do we reach that? Where is the ambulance? What is the number for the ambulance? There is no point in hitting a yellow pages in the middle of the night. All of this should be already written down somewhere. If an older person in the house complains of chest pain at a particular point of time, whoever is there should be able to call an ambulance. The number should be available there. Tell the ambulance that this is the nearest hospital with all the facilities. Please take us there. And call that hospital ahead of time and telling them, saying that there is a patient with chest pain we are bringing. I'm suspecting a heart attack. Please be prepared in the emergency so that the transport of the patient, the receipt of the patient in the hospital, and diagnosis and treatment are smooth, fast, therefore safer for the patient. So I think this is the first aid one has to prepare. Many of us are not prepared with that. Sometimes it's ourselves who develop chest pain. So who will make the call? Do all the family members know what is to be done? Supposing we are not there, the family members are not there, an elderly person is at home and there is a domestic help or a carer who is taking care, will that person know what to do? I mean, it can't be like they call us and say, your mother is having a heart problem. I can't say that, wait, I'm coming from Whitefield, I'll come and pick her up and then take her to some hospital. It can't be like that. So it has to be a short loop, and all of us have to be prepared with that. I think that is the first aid which we have to, prepare. Now, I'll stop here because these must have spurred some thoughts from you, and I'm sure there are questions because I can keep talking, it doesn't make any sense. I think your questions about heart diseases and other things will be very important. So I will stop here, and I will request one by one unmute yourself and ask the questions that you come with. Thank you very much.
Hello, doctor.
Yeah, I will type the name of the tablet. Christopher Secure has asked. I will write the name of the tablet. Meanwhile, yes, somebody can ask the question.
Yeah, doctor. Can you hear me, doctor?
Yes, sir. Yes, sir. Please go ahead.
Yeah, my question for you is first thing, you said if anyone complains of a chest pain at home, you can give aspirin immediately. But
Yes.
what if we don't know whether it's related to heart or gastric? Can we just generally give aspirin?
That's a very good question because this question has to, we don't know what is happening. Can we give this medicine? Also, how do we differentiate whether it is gas or a chest pain? So, I mean, heart disease. That itself an important question. Sometimes it's very difficult to discern whether it's a cardiac problem or gastric problem. In fact, sometimes when patients come to the hospital, we doctors think that it is heart attack and it turns out to be something else, maybe gastritis or muscular pain. The other way also, patients are very confident that I don't have a heart disease, I have muscle pain, and then it turns out to be a frank heart attack. So these things are known to happen. But one is that whenever there is a suspicion, giving one tablet of 350 milligrams of aspirin is harmless. It has been proven that it can be safely given. And second, once you give, we take the patient to the hospital, and in the hospital, the patient is evaluated. If it is not a heart disease, subsequently, whatever gastritis medicines are given. And if it is, this helps because giving aspirin at the first instance of pain reduces the mortality, death rate by 22%. Almost 1 in 5 lives, which would have been otherwise lost, could be saved by this simple tablet. So it is worthwhile to give. However, there is always a caveat. Somebody gets a pain and they are taken to the hospital. The doctors check and say, this is not a heart attack. This seems to be some non-cardiac problem. And they send the patient home with whatever treatment. And subsequently, maybe a week, month, or a year later, a similar pain comes, exactly similar pain comes. There is no point in again taking aspirin and rushing to the hospital. So a similar kind of pain recurs, then perhaps one need not do this exercise. But if a different kind of pain comes, supposing I get gastritis pain here all the time, but this time I get a pain which is here and it goes there or goes to the left side, it's a different kind of a pain. Then again, one has to be alert that this is not my usual gastritis or muscular pain. This seems to be something new, and then taking the patient to the hospital makes sense. And at that time, again, aspirin can be safely given in a suspected heart disease. One dose does not cause major side effects. And if it is a heart disease given, when given, this aspirin is, kind of like safe.
Okay, and I have one more question regarding same, doctor.
Yeah.
Can anyone take aspirin regardless of their any other medical conditions at that time? Or if they had alcohol or anything, like in my house, my father is a little bit alcoholic. So if he says something like in the morning or in the middle of the night, can we give the aspirin to him?
Yes. The only problem about the prolonged use of aspirin is it can give rise to gastritis or ulcers. There are some people with severe bleeding diseases. So for those patients, aspirin can be a little bit of a challenge. But a single dose given as a prophylactic against a heart attack is safe in most of the patients. So unless somebody has specifically told never take aspirin, or if there is an aspirin allergy which has been there proven before, in all other cases, taking aspirin should not be a problem. Alcohol does not interfere with aspirin action, or it doesn't interact with the drug, so there is no concern here about safety of taking aspirin when the patient has had alcohol. Even at the time when the patient has alcohol, many times it happens they are sitting in the evening and having alcohol. At the time they get chest pain and a suspicion of heart attack is raised. At the time also, aspirin can be taken.
Thank you, doctor.
Any other questions? Anything goes. So if you are there, you can ask.
And I have one more question, doctor.
Yeah.
What do you mean by sedentary, doctor? Is it sitting for prolonged time, or we are not doing enough activity? Actually, what is the meaning of sedentary, doctor?
Sedentary is somebody who is not physically active. It cuts both ways. One is that our jobs, for example, we are sitting on a desk and we are mostly our job is not like a physical activity. Like, for example, somebody who pushes a cart, or somebody who lifts weights, or somebody, an agricultural worker who works in the farm. So we are salesmen who go from place to place by foot or by cycling. So those are non-sedentary jobs. Other desk jobs are sedentary. That is one. Second thing is, I mean, you could have a sedentary job, but could be exercising regularly, going for a morning walk or a gym or yoga, whatever it is. So sedentary is absence of either of these. I mean, both of these. Neither are we exercising regularly, nor our work allows us to have enough physical movement. So this, constitutes sedentary, disposition.
And hopefully, I'm not bothering you too much.
No, not at all. Please ask, because I came prepared for about, whenever I go for this kind of a talk, generally, even if there's a crowd of 10 people, I get about 50 questions. So there's so many. I mean, I understand that most of you already know what I'm talking about. This is a different kind of crowd. But yes, I've come prepared for questions. So please go ahead.
Okay. The last question is, doctor, I'm not a smoker. I'm not much of alcohol also. You can consider me as non-alcoholic only. But I do have a friends who smoke a lot. So I stay with them whenever we go out. So how is that going to affect for me or my health on the heart, doctor?
So what we are talking about is called as passive smoking. That is, your friends smoke and you get the tobacco exhalations from there. That is called as second-hand smoke. So it has been proven that passive smoking or second-hand smoking also is detrimental to health. It is also associated with cancers as well as heart diseases. So therefore, when we say do not smoke, it also includes passive smoking. I guess it's an important thing that if you are not a smoker and you choose not to smoke because of health reasons or whatever the reason, if somebody with whom you are or somebody with whom we are chooses to smoke, that's a kind of disrespectful thing for them to do, because they are putting you in danger which you want to avoid in the first place. So therefore, I think it's quite okay to say that I will not join you when you are smoking. I will join you once you finish smoking. It also sends across a message that it's an important thing that smoking should not be there, especially if somebody has had a heart disease. Smoking in front of them is not a good table manner. So I think it sends across a message that smoking is not cool, therefore should be avoided. I think we should avoid both active as well as passive smoking.
Thank you very much, doctor.
So, is there any question?
Yes, good afternoon, doctor. This is Vinitha. The question I have is, how do you know that, what is the first signal that the heart or the body gives that it could be a heart attack?
So, this is how do we recognize if somebody has a heart attack? It's a very, very important, issue. Typically, heart attacks are associated with chest pain. So it's actually a true fact. Almost about 70 to 75% of patients who have heart attack have chest pain. Chest pain is one of the commonest symptoms of heart attack. Typically, the pain of a heart attack is in the center of the chest. There are misconceptions that heart is on the left side, and therefore chest pain is on the left side. And we have seen people pointing towards the extreme left of the chest and saying that I'm having a heart attack. So actually the heart is in the center and it is slightly tilted to the left. So therefore, chest pain in the middle of the chest or maybe slightly to the left of the chest is a common symptom. This pain sometimes radiates, or it also spreads to the left arm, or it could spread to the right arm as well. It could spread to the back of the chest, behind, and to the jaws and the neck as well. So this kind of chest pain, which is either confined to the chest or traveling to one of the sides or up or down, is the commonest symptom of a heart attack. Other than that, some individuals don't, have chest pain. Instead, they have some kind of burning or a vague sort of discomfort. Sometimes it's as if somebody is squeezing, as if some weight has been kept on the chest. So these also can be symptoms of heart attack. Other than that, very elderly people who are long-standing diabetes or kidney disease sometimes don't have chest pain at all. They get breathless. They get extremely tired. Sometimes there is massive sweating, what we call as drenching sweats, or sometimes there can be dizziness or unconsciousness. Some people can have what is called as cardiac arrest as the first manifestation of chest pain. Dr. Harish will be talking about that. Generally, the symptoms completely asymptomatic, that is absolutely no symptom, is very infrequent. It is known. There's something called a silent myocardial infarction known, but it is very infrequent. But these are the common symptoms. Some important pointers I'll give you. Anybody who says there is a pinpoint pain at any point, generally not related to the heart, because heart attack pain is more widespread, diffuse. Sometimes patients have difficulty pointing out exactly where it is. When you ask them, where is the pain, they'll say something like this or something like that, rather than saying that it is exactly one point. So pinpoint pain is not usually a heart disease. Second thing is momentary pain. Some people keep having this pinpricking sensation coming in the chest area, and they get worried that it is heart attack. Any momentary pain is not heart attack. Heart attack pain has to cross 5 minutes, 10 minutes. In fact, most of the time, heart attack pain is there till the patient reaches the hospital and gets treated. So that is how. There is a question in the chat box. What are the immediate measures to be taken if there is a sudden increase in heart rate? It depends on whether it is appropriate or not. Supposing we are anxious, or supposing we run up the stairs, or supposing some kind of a heavy physical exertion is there. In that case, if there is a increase in heart rate, I think we just have to give time for it to settle down. But if completely unwarranted sudden increase in heart rate can be there as a part of anxiety in many people. Sometimes hidden anxieties can come up. One other common thing which we are seeing is post-COVID, we have seen generally patients having higher heart rates than what they used to have. Somebody with a heart rate of 70, 80 earlier now has 90, 100, 110. This has become a little common. Can be evaluated, but certainly heart rates, unexpected heart rates above 140, 150, 160 need to be evaluated. I think you can't do anything about it. If there is a sudden increase in the heart rate of this range, more than 140 or 160, which is unexplained without any reason, then perhaps it's a good idea to go to a doctor, if not immediately, at least the subsequent days, and report that and get checked, because there are different kinds of rhythm problems of the heart which can be dangerous. So that needs to be, taken care. There is one question. What is the difference between heart attack and cardiac arrest? Now we have a beautiful lecture demonstration by Dr. Harish, who will be talking about cardiac arrest. He will be addressing this question. What is a heart attack? How do you differentiate that with the cardiac arrest? How do you diagnose a cardiac arrest? So I'll leave that question to Dr. Harish, who is coming in. So is there a test for heart test in general? How often somebody should get it checked? And the person who asked is 37 years. Now, general, health checks are done. Usually, people are more prone to developing heart attacks after their 50s. But in India, because younger people are getting heart diseases, even after 40s, it's worthwhile getting checked. So I guess after 35, you need to get something sorted. Whether we have high blood pressure, whether we have high blood cholesterol, whether we have high blood sugar, this has to be periodically checked. So if you are 35 and if none of these factors are there, if the family history is clean, nobody in the family had a heart attack, heart disease, and if you don't smoke, then perhaps at 35, once every 5 years till the age of 50, one can get periodic check. during this time, I must say that just because some checks were done, everything was fine, it doesn't give us the liberty to, be free on our lifestyle. We continue to adhere to a good lifestyle, dietary precautions, exercise, moderation of alcohol, stopping smoking if we are already smoking or not smoking are very important. If these are done, this 5 year, once in 5 years should be sufficient. Periodic, every year doing a health check doesn't work, especially when we do the test and everything is found to be normal and we go back to our lifestyles, going back to unhealthy diet or smoking, that doesn't work. So that probably is the way. Is there any other question which you want to ask on? I've seen chat box, but if anybody wants to ask a question on live. Okay, I'll answer this question. What is the prevalence of heart attack in younger generation now? We did a study and we found that under the age of 50, about 30% of all our heart attack patients were under the age of 50. Under the age of 40, 15% of all our heart attack patients were under the age of 40. There were outliers, some 20, between 20 and 30 as well. So in younger individuals, almost 1/3 of all heart attacks are happening in younger individuals who are 50 years of age. And this question about non-vegetarian food, I don't think it really matters whether we are vegetarian or non-vegetarian. The problem is with the intake of what kind of food we take. Now, what has happened over a period of time, there is increased consumption of refined carbohydrates, polished rice, the flour, which is extremely refined, lot of sugar consumption in not only as free sugar sweets, but also in cooking, especially if you go to restaurants, they put sugar in practically everything. So this has increased the risk of lifestyle diseases. So eating a steak or 2 or 3 eggs in a day should not matter, but how do you eat it is an important. Because when we advocate consume eggs because you need proteins, people eat it as a sandwich. If somebody says, can I eat chicken? I say, yes, they make chicken curry with a lot of rice and eat. Again, if somebody says fish is very healthy, I want to consume it, you are having it with some kind of chapatis. So it's not the non-vegetarian food that matters, but how we consume it. Usually, even in families in India where so-called non-vegetarian families, non-vegetarian food is the side dish. The main course is always grains, a lot of rice, ragi, wheat. So it's the consumption, excess consumption of these that causes problem. That needs to be reduced. Eating non-vegetarian should not be a problem. I'll answer this question about physically fit people getting heart attack while working out. Now, this is a very important thing. Exercise prevents cardiac disease. We saw that in the first slide. But the problem is when we become over enthusiastic about exercise, many people start exercise without any pre-assessment. I'd say that if you are more than 40, if you are going to get into some kind of exercise program, other than probably walking, jogging, long distance running, serious gymming and all that, it's a good idea to get a physical health check done before to see whether there is cardiac fitness. That is number one. Second thing is sometimes over enthusiastically we sign up for things which we didn't. Yesterday I saw a patient who had gone for a trek 15,000 feet. I forgot the name of the peak which he climbed. And while coming down, he had chest pain. He came to the hospital now. This happened about 15 days ago. Now we checked him yesterday, and we know that he had a heart attack while climbing down. So this because he had never done that kind of trekking before. So the question about exercise is start low, build gradually. Because what happens is when we suddenly escalate the intensity of our exercise, the blood flowing through the arteries of the heart moves so fast that it can rupture some of the cholesterol depositions which are there, and that can lead to a cardiac arrest. Heart attack. This is called as plaque rupture in medical terms, but this is what happens if there is undue escalation of exercise intensity. So therefore, whatever we do, there has to be a kind of gradual scaling up. Training has to be scientific. If you are signing up for a half marathon, we should train either with a professional group or we should see, websites where all these things are, scientific training manuals are there. I'll take a last question because Dr. Harish is waiting to give you a demonstration lecture about cardiac arrest. What causes heart rate to be higher? Sometimes I've seen very close relatives when some food taken causes rate to be high. We do not know really what causes heart rate to be higher. If the patient has some underlying anxiety, physical debility, that's one of the reasons. But otherwise, most of the time, in this absence of physical fitness, that's one of the reasons for high heart rate. For example, if we exercise regularly, we know that elite athletes have lower heart rate. Similarly, if you are not exercising regularly, our heart rates can be higher. It just shows that the heart is not that efficient in pumping. So therefore, I think it's important to keep physical fitness. Lack of physical fitness is one of the important reasons for high heart rate. Heart attack, yes, is related to genetics from both parents, both father and mother. Teenagers don't have to really get health checks done. The important thing is we see that now progressively with generations, younger and younger people are getting heart attacks. In my grandfather's generation, 80-year-olds got heart attack. In my dad's and our generation, 50-year-olds or 40-year-olds are getting heart attack. The way lifestyles have gone, lack of exercise, physical activity, increase in junk food consumption, very early age of taking up smoking and alcohol in younger children, the heart attacks, heart disease will come in younger children in the next generation. So therefore, I think we have to educate them about diet, exercise, and keeping off from smoking and alcohol. That is number one. Number two, if children are going into elite athleticism, somebody is going to go to world or national level, international level sports, football or hockey or athletics. So those people will undergo cardiac check because there are some hidden cardiac diseases other than heart attacks, which can be a problem. So elite athletes, when children are getting into competitive sports, especially at national and international level, some heart check has to be done. So I'll stop here. It was a pleasure talking to you. I hope there were the questions which you raised, I was able to satisfactorily answer. In case you have further questions which I didn't have the time to answer, please send it across to Mayur Natarajan. I will mail back with replies on all of these things because I think it's very important that questions are always answered. With this, I conclude my discussion. I would invite Dr. Harish. Dr. Harish is our senior physician at the emergency. He's in charge of our emergency medicine department. He runs a very efficient team of emergency physicians who are able to take care of all kinds of emergencies, both cardiac, trauma, neuro, everything. Dr. Harish has a passion of teaching people cardiopulmonary resuscitation because somebody has a cardiac arrest on the road. The only way today in India things can work is when we know how to do basic CPR and revive such patients. Dr. Harish will have a demonstration with a mannequin. Before that, obviously, he'll tell you how to recognize cardiac arrest. Dr. Harish, please take over the slides. Thank you so much.